Good afternoon. Today is May 14th, and today I'll continue to be talking about the coronavirus. So the first piece of news that I'd like to talk about is that Governor Gavin Newsom of California proposed steep cuts to public schools and universities and healthcare, among other programs, as part of a revised state budget announced today that reflected the sudden loss of income brought on by the pandemic. So the budget slashes spending by 9% overall from the initial proposal the governor made in January, and as Mr. Newsom's administration is projecting a 9% drop in overall economic activity because of the crisis. The state is also predicting that unemployment will peak at 25% this quarter. So I think this just shows how California is in an unprecedented emergency, facing massive job losses and shortfalls in record time. And I think this budget just reflects this emergency and so basically to cushion this blow of a 22% decline in revenue, the governor proposed drawing down the state's so-called rainy day reserves of $16 billion over the next 2 years. And Governor Newsom also said that he would be negotiating with unions to reduce the salaries of state employees by 10%. And the pay cuts would include the governor and his staff. So I think what the federal government can do right now is that they can step in and perhaps help the budget of all the states, because if the federal government stepped in, then we wouldn't have to slash the budgets by so much. The second piece of news that I'd like to talk about is that many young adults have been facing strokes, even though they were too young and perhaps their body was in prime health condition and they didn't have any diabetes, high blood pressure, or the kinds of medical conditions that can set the stage for strokes. And so neurologists in New York City, Detroit, New Jersey, and in other parts of the country has reported a flurry of such cases. So I think this is the unexplained strokes are yet another insidious manifestation of the COVID-19. So strokes are very rare to young adults, but now as we see an increase, they do have catastrophic results, including cognitive impairment, physical disability, and even death in severe cases. So I think this is just extremely startling and very, very worrisome thing that we're seeing strokes in young people who had just minor cough or no recollection of virus symptoms at all, and yet they have a sudden stroke. So this is just a very worrisome, and for some patients, a stroke was the first symptom of a viral infection. So, and also here is shown that many people have been scared to go to the emergency room when they have a stroke in fear of contracting the virus. But strokes can't heal themselves, so you have to please seek emergency medical help because you could risk being permanently disabled if you do have a stroke and need long-term healthcare. The third thing that I'd like to talk about is that a new study published in the journal Lancet has talked about the children with a mysterious pediatric symptom. So many children in the United States have been stricken with a deadly inflammatory condition called pediatric multisystem inflammatory syndrome. And 3 children have died in New York State, and many more have been infected. This has also been reported in European countries, and this is extremely dangerous. And so this new study, doctors in Italy compared a series of 10 cases of the illness with the cases of a similar rare condition in children called Kawasaki Disease. And so during the 2 months from February 18th to April 20th alone, the hospital treated 10 children with this inflammatory symptoms, and they had 10 cases in 2 months, which is about 30 times the rate of the Kawasaki disease cases, which occurred at a rate of about 1 every 3 months. So this suggests that a cluster is driven by the coronavirus pandemic, especially since the hospital admissions rate was lower. The next comparison was that they have been children who have been hit with this mysterious syndrome was usually older than 5, and the average age was 7.5. When Kawasaki patients was usually around the age of infants and preschoolers, and 8 of the 10 children tested positive for the coronavirus antibodies. And the research also suggested that negative test results for the other 2 children might reflect that the tests were not perfectly accurate, and that one of the children had just been treated with a large dose of immunoglobulin, which could have interfered with the test's ability to detect antibodies. None of the 10 children died, but their symptoms were more severe than those experienced by children with the Kawasaki disease. They were much more likely to have heart complications. 5 of them exhibited shock, which did not occur in any of the Kawasaki disease cases, and they had a lower count of platelets and a type of white blood cell typical of COVID-19 patients defending against the infection. And one of the children with the new syndrome needed treatment with steroids, in addition to the immunoglobulin treatment that the Kawasaki patients received. So I think this just shows how the mysterious syndrome is extremely serious, and it is from the COVID-19. That's it. Thank you for listening, and have a good day. Thank you.